All right. Waves in front of the camera. Okay, so we have a 21-year-old male who was bitten on the left forearm by a dog. He's conscious and denies any other injuries. An animal control officer is at the scene and has restrained the dog. Your assessment of the patient's arm reveals a large avulsion with a peeled back flap of skin. Distal circulation is adequate and the patient is able to feel and move his fingers. In addition to bleeding control, you should. So now we read our 4 answers, right?
Mm-hmm.
Perform a rapid head-to-toe assessment. Apply oxygen via non-rebreather mask. Irrigate the wound for at least 15 minutes. Replace the avulsed flap to its original position. Okay, so in addition to bleeding control, you should do what?
Replace the flap.
Okay,
Oxygen.
why?
Apply oxygen.
Why replace the avulsed flap or why apply oxygen?
Well, I guess.
That's what you do with bleeding when you shock.
Okay,
Yeah.
where are we at in this patient?
Circulation.
Oh, we're past controlling bleeding. We're in
Right.
secondary.
And then second of all, is this does it say anywhere in here that he had severe bleeding
No,
to be putting somebody in shock?
no.
No, he just had an avulsed flap, right?
Mm-hmm.
Okay, and he denies any other injuries. So what needs to be done for him?
Well, before you can like bandage him to transport, you should just tuck the flap back where it was.
Okay, so which one is tucking the flap back where it was?
Replace the
D.
avulsed flap.
Okay? Now, as I say with all of these, that would be my thought process. I can also be wrong. I am not perfect when it comes to taking tests.
Right.
So there's always the chance, right, Micah?
Yeah.
That I am wrong.
Unless it's irrigated out because you need to clean it before you put it back.
Do you clean the avulsed flap? And how long are you wanting to clean it for?
Probably not 15 minutes.
Right.
It'd probably be less than that.
Well, you would probably clean it, but do you want to spend 15 minutes sitting on scene?
No.
No. So, an avulsion is an injury that separates various layers of soft tissue, usually between the subcutaneous layer and fascia, so that they become completely detached or hang as a flap. The patient's injury is isolated and not life-threatening, therefore a rapid head-to-toe assessment is not indicated. Would this be a rapid head-to-toe or a focused? Focused. Unless your protocols specify otherwise, oxygen is usually not necessary for patients with isolated, non-life-threatening soft tissue injuries. If the avulsed tissue is hanging from a small piece of skin, circulation through the flap may be at risk. If you replace the avulsed flap to its original position, as long as it's not visibly contaminated with dirt or other foreign materials, then cover the wound with a dry, sterile dressing. So think of it like a hose, little hoses going into the flap of skin, and you're kinking it when the skin flap is back. Okay, so when you replace it back, how are those hoses now? They're able to perfuse. Okay, that's when you replace that flap of skin, otherwise you're gonna lose it. And they can hopefully, it's not like we just peel back the epidermis. I mean, we've got a big flap of skin with epidermis and dermis, possibly some subcutaneous fat here. Okay, you replace it back and they possibly can stitch it back together. Okay. All right, next one.
Haley said her phone's not letting her pick up.
Okay, tell her there will be a YouTube video that she can watch, and I will let her know when it's done. 52-year-old man crashed her minivan into a tree. 52-year-old woman, not man.
Man
52-year-old
crashed her
woman.
minivan.
Okay, she is pinned at the legs by the steering wheel and semi-conscious. After gaining access to the patient, you should perform a primary assessment, provide any life-saving care before extrication. Immediately apply high-flow oxygen to the patient and allow extrication to begin. Rapidly assess her from head to toe, obtain vital signs, and apply a cervical collar. Have the fire department disentangle the patient and quickly remove her from the car. Okay, she's semi-conscious.
Mm-hmm.
All right, what do we need to do first? Think about your patient assessment.
ABCs
And where do we find our ABCs?
in the primary assessment.
Okay? And what else do we need to do for this patient?
Get her out of the car.
Okay?
Immediate life.
And what word in there says get her out of the car?
Extrication.
Okay, so we need a question that has extrication in it.
Mm-hmm.
Doesn't mean whatever they say, what we're doing with extrication. It just has to have extrication. Number 2, what are we doing? We need to provide ABCs because she's semi-conscious. Could her airway be compromised?
Yes.
Could there be a problem with her breathing?
Yes.
Could she be bleeding out?
Yes.
Okay, so we need to take care of that. Does high flow oxygen take care of bleeding out?
No.
What does it take care of? Just breathing.
Oxygen.
Does it take care of maintaining a patent airway? And we allow extrication to begin. So that one just covers one aspect, okay? As I said with the last class that I did with this, you ask a vague question, you get a vague answer. You ask a specific question, you get a specific answer. This is asking a vague question. Okay, after gaining access to the patient, you should do one of the following things.
Mm-hmm.
Not after you do this specific step, you then do this specific step. Okay, it's not a specific question, it's a vague question. So, should we just have the fire department disentangle her and quickly remove her from the car? What is that saying right there? What
Just
word is that
extrication.
defining?
Extrication.
Extrication. Okay, that would just be extrication as itself.
So A.
So A. Okay, unless there is immediate threat to fire, explosion, or other danger, you should perform a primary assessment and begin any life-saving care as soon as you gain access to the patient. Okay, can we do a head-to-toe on this patient?
Not very easily.
Not very easily. Okay, once we get them out, we can do all the head-to-toe, spinal precautions, and all that fun stuff. But right now, we're just going to do primary assessment and any life-saving care that needs to be done. Open that airway, get them breathing, whatever before extrication. So don't just look at the words as how they are when you're taking the test. Look at the words in what they're saying. So if they have in there primary assessment, extrication, if that's what you know you need to do, then that's the question you need to go with, not how it's being said, and provide any life-saving care before extrication. Okay? Is it saying, what I'm saying is don't overthink the question and think, well, that just means we're just going to do life-saving care, we're not going to do extrication. It just says before extrication. It doesn't say extrication is going to happen in the next minute or in the next 5 seconds. So don't overthink the question. And that's what I mean when I say don't overthink it. Which of the following patients would be least likely to present with the classic signs and symptoms of an acute myocardial infarction? Anybody
Female
else?
norm-
I know
female
it's,
normally have it
yeah.
more than- And then
Why do you say, do you think in anything else, Nicole?
It would either be A or D
Okay, why do you say A or D?
because they're female, so
Okay.
a lot of times females have different signs and symptoms of a heart
That's very
attack
right.
than what's well known. And then the A, because of hypertension, like she's probably got a lot of problems like that already,
Okay,
and they may present differently in her.
there's a big
It
one
also
right there
present-
before the hypertension.
it presents
Diabetes.
differently with
Diabetes. Diabetics have decreased nerve receptors because of that increased sugar usually in their body. They usually present with neuropathy. So they don't feel it and they present differently. Males with diabetics don't present the same with chest pain as regular males who just don't have diabetes, okay? So a female who has diabetes and hypertension is gonna be least likely to present with the classic signs and symptoms, okay? Because also, if she has hypertension, she's going to be living with that for a long time. When the heart starts having problems, it's going to pump harder, it's going to have hypertension. So she's not going to notice the different signs of when she's got a blood pressure of 120 over 80 versus a blood pressure of 180 over 60. Okay? The person with hypertension is going to be living like that for a long time, so they're not going to notice the change in blood pressure. okay? So that's why we go with A there. Okay, makes sense?
Mhm.
Alright. Immediately following a generalized motor seizure, most patients are
Confused.
okay. Does that make
Lost
sense to
along the
everybody?
way.
Mhm.
Any questions on that? Respiratory system functions by
B or C?
You can see,
okay, so you've eliminated two.
Yeah.
Okay.
but it doesn't eliminate carbon dioxide.
No. That's true. C?
What do you mean it doesn't eliminate carbon dioxide?
You exhale, you don't eliminate it. Carbon dioxide's still there, it doesn't die.
Okay,
Well,
but
almost
what's another way to think about eliminating? What's eliminating mean? Eliminate doesn't mean vaporize,
Get rid of,
to get rid of. How do we get rid of carbon dioxide?
exhale it.
Exhalation.
Okay? So the respiratory system and the ventilatory system, which is which?
Respiratory is just the gases in and out, and the ventilatory is the
I had that wrong.
physical act.
Yeah.
Ventilatory, because when we count ventilations, we're doing ventilations. It's
Mhm.
mechanical.
Right.
Respiratory, respirations is chemical. Okay?
So in that case, yeah, ensuring adequate oxygen is delivered because it's the chemical, not the mechanical aspect.
Okay? Nicole?
I
You
agree.
can't just sit there, you gotta talk.
I agree.
Oh, you can't even do that either. You gotta give us an adequate, if you don't agree, then we need to go with a different answer. What are you thinking?
I think it's C.
Okay?
Hot or wrong?
Okay, so the function of the respiratory system is quite simplistic. It brings oxygen to the lungs and eliminates carbon dioxide. The act of pulling down and pulling the air into and then pushing it out, bringing the air in and pushing the air out, is ventilation. That's the mechanical process. But when we talk about oxygen and carbon dioxide and switching them, that's the chemical process, okay? Don't think chemical process is in, we add acid and a base, like vinegar and baking soda, we get a reaction, okay? Don't think that. Think about if we have two chemicals, carbon dioxide and oxygen, are those not on the periodic table of elements?
Mhm.
They are, okay? And we put those two in a spot and we exchange them. We're doing this. We have a reaction. Does the body not react when we have lots of oxygen?
Yes.
The O2 set goes up. If we increase the amount of carbon dioxide in the body while we're exercising, we produce lactic acid and our muscles cramp. Is that not a reaction?
Mm-hmm.
Yes. So introducing those two chemicals into the body, that is the chemical reaction right there, okay? So first you have to understand what the chemical reaction is, understand what the chemicals are, and then you can answer this question by bringing oxygen into the lungs and eliminating carbon dioxide. Does that make sense now?
Mhm.
Rapid transport of a patient is ingested a large dose of Tylenol is important because
I think D.
I'm
we
gonna
have,
s-
and you
I
have
was gonna think D.
D.
Well,
Okay.
I think you don't really need rapid transport if it takes you 6 hours.
Think about what you're dealing with. We'll go with D if that's what the populace thinks, but stick with your guns on your answers, okay? So, acetaminophen, the active ingredient in Tylenol, is a safe drug if taken as directed. However, ingestion of more than 140 milligrams per kilogram in an adult can cause liver failure and death. Symptoms of the acetaminophen overdose do not present acutely, okay? Remember, these have to be ingested, digested, and then metabolized to be used.
Right.
It can take weeks before signs of liver failure are apparent. Is liver failure something that's going to happen within the next 15 to 20 minutes?
No.
No. Okay? You take somebody to the hospital who's ingested alcohol and they want to stick what type of tube down?
NG.
Why?
To suck the stuff back out.
Because they have time to suck it back out.
That makes sense.
Okay? We have time to get them to the hospital. That's why we exist, folks. Okay? To rapid transport this patient. And look at the question again. Why are we rapidly transporting this patient? Rapid transport of a patient who ingested a large dose of Tylenol is important because
They're gonna die in 6 hours.
liver failure usually occurs within 6 hours.
I can tell you honestly that the word antidote is what threw me off. I don't know why.
Okay?
It just
An antidote doesn't mean that it has to be a drug.
right.
An antidote, okay, an antidote could be a treatment plan or some type of technique that they could do. They could pump their stomach, and then they could hit them with an antidote medication that will block the effects of non-steroidal anti-inflammatory drugs.
Is this not something that they could have given activated charcoal for? I know that's not part of the question, but
They could, but it says at the end, after 1 to 2 hours following ingestion, activated charcoal would likely be ineffective.
okay.
Okay, because they're already starting to metabolize it. Activated charcoal only works in the stomach. Okay, once it gets metabolized and starts going throughout the system, activated charcoal is no longer going to work.
Okay.
Does that make sense now?
It does.
So remember to read the question, read your answers, then read the question again and see what it's specifically asking and see which one of those answers. And sometimes take your answer and read it with the question, as in, rapid transport of a patient who ingested a large dose of Tylenol is important because liver failure usually occurs within 6 hours following a Tylenol overdose. Does that make sense to you to say rapid transport and within 6 hours? We've got time within 6 hours to get
That
this
is-
patient
We
taken
could
care
walk
of.
the
Yeah.
patient to the hospital.
But a rapid transport of a patient who ingested a large dose of Tylenol is important because an antidote may prevent liver failure if administered early enough. Rapid transport, early enough, those two sound very close in the same type of words. Rapid administration, rapid transport, but rapid transport and within 6 hours, that's a long amount of time.
That is
Okay.
true.
Think about transport times with a lot of these questions as 15 minutes or less, okay? Not Larned where you're transporting out all the way from the Pawnee County line and Hodgman County line and you've got 30
Yeah.
to 40 minutes into the hospital.
Right.
Hospital better be ready when you get there.
A preferred method for inserting an OPA into a small child is to
Oh.
Depress the tongue with the tongue blade. And then insert the curve.
D.
I kind of thought D too.
I don't, unless I'm wrong and I don't remember learning a different way to do it on a pediatric, but
Okay. On pediatrics. Okay. Tell me the physiology of a pediatric, or the anatomy of a pediatric with their airways.
their tongue's bigger.
Okay.
So you would have to depress it so that you could get in there, maybe.
Okay. And if you depress the tongue, do you have to do the technique of
No.
twisting and rotating?
No.
Okay. What about insert the airway with the curvature towards the roof of the mouth and then rotate it 180 degrees?
That
feel like
would be
that could hurt the
uncomfortable.
child.
Why?
I don't know. Feel like
I feel like it wouldn't go in because then the little bump would be.
So when they say a small child, always think be very specific or be very what's the word I'm looking for? Cynical with what they say. So think small child. Don't think a 4 foot tall 8-year-old. Think a short 1-year-old. Okay, a very small baby. Okay, to the point that it's the smallest child that could ever be above the age of 1. Okay, because they didn't say infant, they said child, right? Think of the smallest kid that you can think of that's 1 year old, and then how you're going to put that airway in. So, are we thinking B?
yeah.
Yes.
Okay, keep in mind that the child's tongue is
There it
proportionately
is.
large. Preferred method for inserting an OPA is to use a tongue blade. Okay, all a tongue blade is what we call out here in western Kansas
A popsicle stick.
a popsicle stick tongue depressor. Okay? And then slide the airway straight in with the downward curve of the airway. This rests just beyond the curvature. If you use an oral airway that is too small, it will not reach the curvature of the tongue and propel it forward. If you use an oral airway that is too large, it may obstruct the airway. Oral airways are rigid and the heart palate of a child is rather fragile. Okay? If improperly inserted, oral airway could lacerate or fracture a child's hard palate. Okay, they're not fully developed in there. So if you go in that 180 degrees, as you said, it might hurt it,
Mm-hmm.
So just think kind of with some of that common sense when you're taking these test questions is, hey, that might hurt them if we put it in at 180 degrees, okay?
Who's the one that did that?
Mm-hmm.
When caring for a patient with an acute behavioral crisis, your primary concern should be
A.
Yep.
A.
why A. Nicole?
BSI is my
Because
scene
you
thing.
come first.
Yes, we do.
And then maybe completing past medical history.
You're caring for a 6-year-old child with a possible fractured arm and have reason to believe that the child was abused. How should you manage the situation?
C.
Yeah. Because you can't transport without
C.
parents' wishes, whether it's abused or not, unless law enforcement tells you to. I think.
Hello. You're fine. Okay. Oh, you're fine. You can go ahead and do whatever. What's your answer?
Call the police.
Yep.
Oh,
No.
wait.
C.
No,
Have
C.
somebody
It's
arrested.
C.
You're just gonna automatically call the police and have the
No.
parents arrested.
You need to report it though, so that's what I was thinking. I'll just-
Micah lives by his own rules.
Okay, what, are you supposed to judge people?
Nope.
No.
No. But what is ultimately needs to be done with this patient?
They
Don't
need
get
transport.
stuck on the fact that the child was abused.
May have been.
May have been abused. There you go.
So advise the parents the child needs transported
Why?
because the child doesn't have any rights.
Why?
Because the parents are.
Read the question again.
You are
Because the
calling
patient has a
parents-
possible fractured arm.
Yes.
Don't
That's
get tunnel
why
vision on the
he
fact that the
needs
child
to
was
be
abused.
transported.
Did the child fracture their arm?
Yes.
Do they need treatment for the fractured arm?
Yes.
Boom. Okay, we don't need to worry about whether at this point, whether the child was abused. Yes, you're gonna have to probably fill out paperwork later on, but what is the most immediate concern here? Not the fact that the child was abused. Can we do anything about that abuse? No, it's already in the past. It's already happened. But what can we do? We can
Transport.
stabilize, check PMS, move that patient, get him on the cot, call for ALS if we need pain management for this patient, okay? And get him to the hospital. So So who needs to be advised that the patient needs to be transported?
The parent,
Why?
because they're.
He's a minor.
There you go. What? Yeah. Okay, so you must never accuse the parents or caregivers of abuse, because if you're wrong, you can be held liable for slander. Okay? Action that was such accusations include summoning the police to have the parents arrested. Like every episode of Chicago Med. They're always calling somebody having abuse. Okay? And they always screw up because it's not abuse. Okay? So if you watch Chicago Med,
I
watch
haven't
that.
seen an abuse episode yet.
Well, when you see one, you'll know it. You'll be like, really? Really? Every time. The pediatric nurses always, or doctors always call them for abuse. Which of the following statements regarding sudden cardiac arrest in VFib is correct?
D.
It's D.
Let me finish reading.
Come on, Slowpoke.
Is it really only 2:45?
Mm-hmm.
D.
What?
D.
Okay,
Although
work through it with me.
I want to say A.
Patients are with ventricular fibrillation are typically unconscious,
Yes.
apneic,
Mm-hmm.
and have a weak, irregular pulse.
Because it's just twitching.
It's quivering.
It's quivering. So does that mean that they're getting any blood flow out? What do we have to have a pulse?
I guess you have to be pumping blood.
Uh-huh.
So they probably wouldn't have a pulse.
So isn't there?
Yeah,
Because
but-
in our CPR scenario, they're pulseless and apneic.
Uh-huh.
So I'm taking back my answer.
You're gonna take back your answer.
Yeah.
Going
Okay. VFib is never, ever, and will never, ever, 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 ever on God's green earth, as God is my witness, will ever have a pulse. Ever.
He's gonna have a heart attack. There's gonna be VFib, and he's
No,
gonna have
I
a
won't.
I
slight
changed my
pulse.
answer to A, please. And thank you.
I'm
Okay.
on A because that's what the Red Heart says, or whatever. American Heart Association.
What? What?
Yes.
Whoa! What? You said what?
American Heart Association.
You like remembered stuff from class?
Haley, you're missing out on Nick's facial expressions right now.
Let me hear. Like, what?
This way.
What?
There you go.
What? Okay? VFib is chaotic quivering of the
You
heart
were wrong.
muscle.
He said D first.
No, I didn't say defib. And defib is not a heart rhythm. Defib is defibrillation.
No, she
I
said.
he said D. He goes, I was right. I was like, you said D just like us.
Oh.
I changed it to A.
Defib is
that
not a
results in
thing.
sudden cardiac arrest. In VFib, the heart is not beating effectively and is not pumping blood. Therefore, the patient will not have a pulse.
That's the one where you have like a weird pulse.
VTAC.
Yes.
And it will be a fast pulse because it is normally regular. An irregular pulse is a fib, meaning the atria is fibrillating. Because where does the blood get pumped out of? The atria or the ventricles?
Ventricles.
The ventricles.
Asystole is.
Dead.
Yep.
Okay. Alright. Boy, sometimes
That's a waste.
What?
which of the following statements regarding VFib is correct?
This stuff just flies everywhere in the hospital. What?
Did we
B.
just do this one?
I don't know. Maybe you should just answer this one to the best of your abilities.
B.
Yeah, B.
Nicole?
B.
Okay, next question, nobody answer, and Nicole has to answer.
I was reading. Why do you pick on me?
I pick on you
You
because
pick on me.
I picked on Anne Marie when I was up there in Winston, did I not?
Yeah, you
I'm a
Because
silent.
she was sitting there, not saying anything, and was waiting for everybody else to answer. So next
And
one,
then we
Micah
put it-
and
then she got a
Haley don't
ticket.
answer.
I am Rachel.
Or
Yeah.
Rachel, sorry.
Haley, you can't answer either.
Haley's
No.
on the iPad.
I'm Haley, actually. All semester I was Haley, and Haley was Nicole.
How are you?
Whatever.
Because,
And-
did you not know it's Carol?
We gotta get through this.
Just-
Haley's
just
gonna have to
read your
watch like
question
4
and
hours of
answer it.
video
And
here.
the active muscular.
The
part
active
of
muscular part of breathing is called
B.
what?
What?
What did you say?
I don't know. I can't do this. It's too stressful.
B as in boy is what
But-
she said.
But now I think maybe D.
Are you sure?
All right,
Remember the last
Nicole,
question I
work
had?
through that. Shut up, Micah. Work through this.
I don't
Fine.
like being put under pressure.
You're fine. You're gonna be put under pressure here in a couple weeks.
Shut up, Micah.
A couple of weeks. I have to wait a couple of weeks.
At this point, yes. The active muscular part of breathing is called what? Look at your 4 answers. Delete 2 of them. Figure out 2 of them that does not make sense.
Not ventilation. And not expiration.
Why not expiration?
Because that's your body relaxing.
Okay? Why do you think inhalation is one of them?
Because, I don't know. Because
You
your
do
rib
too
cage,
know.
your rib cage expands. So it's like, can you go away? He's making noises.
Shut up, Micah.
Breathing.
Do you want to fail your exam?
No.
Then shut up.
I say D.
Why?
Because respiration is you're using your muscles. You're breathing in and out. That's your respiration.
Are you sure?
Yes.
Are you sure?
Yes.
Did we not talk about this earlier today about respiration being the chemical process,
Oh shit. Yeah, you're right.
and what was the mechanical process?
I can't cuss on
Ventilation.
YouTube.
Whoa. Wait, what? Which one did you delete out of there?
Ventilation. Well, I didn't think mechanical because it said muscular.
Is
Oh,
this
God.
not a mechanical
No.
process here? When you take a shovel up in your hands and okay? Is that not a mechanical process? Hello? I'm talking to you. I don't care if you could show Haley what I'm doing here on the screen. She may or may not
Yes,
watch this video.
that is a mechanical process.
Okay? And then man created other mechanical things to do work for us so we could sit around and read comic books all day. Okay? So, and mechanical means we're involving some type of energy and work,
Mm-hmm.
okay, with muscles. What are you doing?
My fucking boss just texted me.
Uh-huh. You gotta go.
Read it out loud.
Would you be interested in coming back and help with 1 East? And then I can't say the rest because it's HIPAA. Wanted to
well,
offer you the hours first. That means she's gonna ask someone else. That means I don't have to go, right?
You could say, no, I am in the middle of something.
Okay.
Which is more important?
School. School is important.
I'm only doing this day and I'm not doing any more days.
Okay.
Okay, so muscular part of breathing, because does it say only on inhalation? Does it say only on exhalation?
No.
No. Okay? Now, the active muscular part of breathing, okay? Ventilation is talking about that, but what could be an active process? What's the relaxation?
Relax.
When we inhale or exhale?
Exhale.
Exhale is the relaxation, okay? So the active process could be
Inhale.
inhale. So my answers are down to inhalation or ventilation. Ventilation is both acts. However, The word I'm focusing in on after looking at this is active. Okay? So, do we think inhalation or ventilation? Because would inhalation be part of ventilation?
Yes.
Is this a specific question asking a specific answer?
No. Yes. Kind of.
The active muscular part of breathing is called?
Oh,
My dog sitting right here next to you is called?
Inhalation.
We don't call your dog, well, that's a dog. That's a vague answer for a vague response. What
Mhm.
is this animal? Vague answer, dog. Okay? This dog sitting next to you, its name is Bob. Okay? Specific answer, or a specific question gets a specific answer. My thought process at this point, looking at this, is inhalation. Do you agree?
sure.
I could be wrong.
Wasn't that my first answer?
It was, but you didn't understand why you were saying it. You didn't understand because you thought it was exchanging stuff. The active muscular part of breathing is called inhalation or inspiration. During inhalation, the diaphragm and intercostal muscles contract. Okay? The diaphragm contracts, it descends and enlarges the thoracic cage from the top to the bottom. You also had respiration in there.
That is.
You had respiration in there as one of
Yeah,
your
because
thoughts.
you psyched me out. I said inhalation, B, and then everyone looked at me like I was wrong. And then you're like, why? And I was like, because your rib cage and diaphragm expand, and that's using your muscles. And then you all just stared at me like I was half stupid, and here we are.
Here we go.
Yeah.
Okay, Nicole, this one is also yours.
Why?
I'm
Why
going to
can't
go with
we-
the answer that you come up with.
Why can't we like us?
It's yours still. You arrive at the scene where a man fell approximately 40 feet and landed on his head. He's unresponsive, agonal gas, and has a weak carotid pulse. Further assessment reveals an open head injury with exposed brain matter. Upon identifying this patient as an organ donor, you should.
B.
Okay? And you said B as in boy?
Yes.
And here's why. It is unlikely the patient will survive his injury. However, he is still breathing, albeit poorly, and has a weak carotid pulse. Therefore, you should begin immediate aggressive treatment and transport him properly, just as you would with any other critically injured patient. It would clearly be inappropriate to request authorization to provide no care at all. It is determined by a physician that the patient will not survive his injury. His organs can potentially be harvested and save several lives. So by treating him aggressively and rapid transport, we're going to keep his organs alive too. All right, Nicole, one more so that we can see that you know what you're doing. Football player complains of a severe neck pain and tingling in his arms and legs after being tackled. He is conscious and alert, has a patent airway, and his breathing is adequate. He is in the supine position and still wearing his helmet, which is tight-fitting. The most appropriate treatment for this patient includes
Either A or D.
okay?
Because you don't want to ever take off the helmet, because that's just gonna. What?
Emery's and Hayes getting ready, like waiting to take her test, and she got out of her van and bent over and ripped her pants.
What? She had what happened?
Emery's and Hayes getting ready to take her test, and she got out of her van or something. She bent over and she ripped her pants.
She'll be fine. Tell her she'll be fine. Okay? Nicole, A or D?
We have tape.
Here's my problem with this question. Best style spinal immobilization device, and do you remove the face mask or not, or is that just gonna jar his head more?
Think ABC.
Okay. Think ABCs. Can you access this airway with a face mask on?
No.
Okay.
So,
And second of all, which is gonna jar more? Taking a face mask off with somebody holding C-spine on the helmet, or taking it off completely?
Well, D, you don't take it off either.
Okay? Now, which is going to be better for him? Put
Probably.
him on a backboard or put him in a kit? Because what is a best style spinal immobilization device?
Okay.
they also put.
So it'd be
Best.
A. It'd be A.
A?
Yes.
You want to put him on a long backboard?
Yeah.
All right, we're going with Nicole's answer, and there you go.
Good work.
That's 3 questions now Nicole has gotten right.
So putting him on the vest style or the kid board and then the backboard, is that just more movement that you
All right, here's
don't have
why.
to do?
Here's the reasoning. Have you been doing these at home?
Yes.
Okay. Helmet that fits well prevents the patient's head from moving and should be left on, provided there are no impeding airway or breathing problems. Does not interfere with your assessment and treatment of the airway, and you can properly restrict spinal motion. You should also leave the helmet on if there's any chance that removing it will further injure the patient. Secure, all right, so let's see here, trying to see where they talk about. Okay, however, if he's conscious and alert, has a patent airway, breathing adequate, the helmet is tight fitting. Thus, the safest approach is to leave the helmet on and remove the face mask. Secure it in a long backboard and keeping him supine and restrict lateral movement of the head with a commercial stabilizer or bolt towels. A vest-style device is more suitable for seated patients. It is impractical to use on supine patients. Because how is he laid?
Supine.
Supine.
Supine. So, don't forget to go back and read the question. Because you read through the question and you go, okay, and you forget all the stuff and there's something, then you go back and read, he is in the supine position and still wearing the helmet, which is gonna be better to move him over to. Think about how you would put on a kid with somebody supine. Think about the night we tried putting the kid on somebody who was supine, who had the hip injury.
That was me.
Right.
And
How easy was it to do that?
It was pretty hard.
It was pretty hard, okay? How much easier would it have been to put you on a backboard?
fine.
My thought with this question was like, if it's a football player, they're gonna have pads on.
Okay?
Do you
And they
cut?
talk about that right here. The mask on spots can be removed. If they have pads on, okay, you remove the pads, okay?
Mhm.
And you just and cut them off, and the pads come off, okay?
Mhm.
And you may place padding under their back, so it doesn't tilt it forward. But his airway's patent, so if he just has his head tilted a little bit forward, he'll be fine, okay? And that's back to that padding the voids, okay? Same way you would do with the motorcycle helmet and other helmets, because it's keeping everything in there, okay? Caring for a 6-year-old child with swollen, painful deformity to the left forearm. As you communicate with the parents of this child, you should.
See.
I heard Nicole say C, or Rachel say C.
Rachel said it. I'm still reading. C.
Why?
Because
Why, Micah? Pick one.
This is what I'm thinking. If you repeat me after, I'm thinking A or C.
Why, Micah? Why, Micah?
Because
Why,
using
Micah?
appropriate medical
Why,
terminology
Micah?
will only scare the patient or the parents.
Why, Micah?
And telling them that the child will be transported isn't in your field. Go
Why,
for it.
Micah? Why, Micah? Why, Micah? Why, Micah?
Make sure
How are you injured, Micah? Micah, how are you injured?
Yeah,
Micah,
it's really annoying.
it is really annoying, isn't it? Okay. How about Micah? Tell me about your cholecystitis myelitis of the anterior lateral forearm with your distal phalange abducting from the core line of your gluteus maximus to your
Those aren't even.
nasal palate of the big giant breakfast burrito of the nacho variety.
Oh, I could go for a breakfast burrito right now.
That's the nacho variety.
No, just one
Okay.
food.
How does it, using medical terminology, we're supposed to use that around patients?
No.
No, we use that in reports and we use that around doctors.
You sound like you have cranial lactosis.
I have no clue what you said exactly, okay?
Break it down, it's funny.
Cranial lactosis,
Lactosis.
butthead,
Yeah.
okay? Then tell them that the child will be transported to the hospital. Well, if you remain them aware of what you're doing, you're going to tell them that you're transporting the child to the hospital, correct?
Yes. See, it would also make more sense if, like, you were talking to the kid because they're really curious.
Yes,
and
but
or
you're gonna
scared.
talk to the kid, but you're also gonna talk to the parents and make sure that
Yeah.
they're aware too. During your assessment of a patient who's experienced blunt facial trauma, you note the presence of hyphema. This indicates what?
Ooh, is that the nasty stuff behind your eye? I guess it's C. I'm like, what's it? I'm going with C.
What do
I'm
you
with
think?
Micah.
No, wait. B. Just.
Nicole?
I would say but I don't know what hyphema is, so I'm not really sure what I would say.
I now know what hyphema is.
Oh.
Blood in the eye.
Okay. And hyphema is pooling or collection of blood inside the anterior chamber of the eye. Blood may cover most or all the iris. See how the blood is like filling up inside like a glass jar.
So C.
I'm right the first time.
And what is one
But
of my
not for the right
techniques?
reasons.
Go with your gut.
Bingo. This is a go with your gut question, okay? So, you rule out all the other ones where you're like, boy, I just don't think it has, definitely not the pupils are unequal, because I kind of know what that is. I really don't know what the other stuff is, but it's specifically dealing with the eye. And then you're just like, I think it's trauma to the eyeball, okay? Don't try to get too specific with what you're doing, but go with your gut and just try to pick the best possible answer. Okay, which of the following is an example of an EMT providing care based on standing orders?
Yeah, no.
Yep.
When an error occurs while using the AED, it's most often the result of
A.
Yeah. Hopefully there's
32-year-old
weird.
man was stung by a bee, has
Kinda
diffuse
shocking.
hives, facial swelling, and difficulty breathing. When he breathes, you hear audible stridor. What does that indicate?
Swelling of the upper ear.
Yep.
Why is that upper airway, Nicole?
What do you mean?
What's the difference between upper airway and lower airway?
Upper airways like this.
Where does it separate at?
Into your
What's the dividing line that separates upper from lower?
trachea, your bronchi. Okay, now I
Okay,
really
down
don't know.
here. Huh?
I don't know. I'm just guessing now.
You are guessing. How about your vocal cords? Vocal cords are what separate. Okay? Think about the vocal cords, how I've said they look like a vagina. Okay? Okay? What separates the outside from the inside on a female?
Vocal
Vagina.
cords.
Right?
Your
Okay? What separates the upper from the lower? The vocal cords. They look like a vagina. Okay? That's the separation right there from upper and lower. And if you have them swelling and you're going all the time, okay, that's a swelling of the upper airway.
So is the wheezing the lower? That's the lungs, which is lower.
Bronchioles
Yeah.
getting constricted. It's a lower sound, okay, because it's lower inside. And that's why wheezing you have to hear through auscultation. And if you hear audible wheezing, it's gone up higher. Okay, the closer you get to the top, the more audible it's going to be.
Right.
Most effective means of preventing the spread of disease is what?
A.
Huh?
No.
A.
Hand washing.
Oh.
It's always hand washing.
Always hand washing, son.
Wash your hands. Wash your hands. It don't matter if you're wearing gloves or not. Wash your hands.
Put the gloves on.
Yes, Micah.
Micah doesn't wash his hands.
Oh, great.
I washed my hands before I came here.
Was that like this
After
morning?
fishing.
one time today that you did it?
So far,
I worked with C. diff today.
Gross.
I fought now.
Which of the following structures is the primary pacemaker which sets the normal rate for the heart?
Can I say it?
No.
Okay.
I'm not gonna say it. I want you guys to figure it out. I'm guessing Rachel knows it.
I know it. Why do you think
I
I, don't
know
know it?
What is it?
D.
Yep. High five.
C. diff. Woo. Oh.
SA node.
You don't know it. It's the sinoatrial node. The SA node, not the AV node.
Oh.
Doesn't it?
Remember, the SA node goes to the AV node, goes to the bundle of his, to the Purkinje fibers.
I just thought AV node was first.
Savvy. Can you be savvy? S-A-V.
I can't be sorry.
S-A to AV. Savvy to the Purkinje fibers. Okay, if you want to think about it, she stole all my markers. I got one
Dare
marker
she.
here.
I have a
Use a
different
Sharpie.
phone. I have that picture on my other phone.
S-A to AV to the, does that look like a Y?
It's like a butt.
Savvy. Okay, S-A to AV to the Y. Make sense?
Mm-hmm.
Is the Y the bundle of his?
The bundle of his and the Purkinje fibers.
Yeah.
Okay, they're not really gonna ever ask you, except for bundle of his to Purkinje. Bundle of his just basically is this portion right here,
The neck.
and then it separates out.
Okay.
Okay, so the SA to the AV to the Y. Savvy?
To the
I did.
So if
I
you see
listened to that song this
sinoatrial
morning.
node, break down the word and take the first letter of it. Sinoatrial. S-A. Atrial ventricular. A-V. Makes sense?
Bundle of
Use of an automated external defibrillator is contraindicated in patients who,
C.
Wait.
what is an automated external defibrillator?
AED.
AED.
You're not gonna use it on someone who has a pulse.
Truth.
Oh. Sorry.
A 40-year-old man has burns to the entire head, anterior chest, and both anterior upper extremities. Using the adult rule of 9s, what percentage of total body surface area has been burned? Okay, so you get this question on your test. Okay, draw your figure. Draw a head. Draw your body.
Ooh, he doesn't have a neck. He's a no neck like me.
They don't really. The head and neck are together. Okay, arms. Draw your
Why
little
does he
Michelin man. Okay, with big junk. Okay,
Of course.
so 40-year-old man has burns to the entire head.
C.
Entire head. Okay, so let's start figuring out what our percentages are first before we answer the question. We all know that genitals are what?
1.
1. Very good. We got that one taken care of. Okay, chest is
9. Abdomen. Like it's divided in half, right?
Right, yeah.
9 and 9.
99.
and then the back is
9 and 9.
okay, so we draw an arrow, we say 18 on the back, we say 18 right here, okay? We're both 9 and 9,
Mm-hmm.
okay? So I'm gonna just kind of erase 9 and 9 there, okay? Arms,
9 and 9.
is that front and back?
No, it's 4.5.
That is front and back, but the front would be 4.5 and the back
Okay,
4.5.
and then legs,
Same.
are you sure?
Isn't the
wait.
thighs 9?
Yeah.
And then that would make what? The calves are,
4.5.
think about the calves. Are the calves about the same size as my arms?
Yeah.
Give or take.
So what would that be?
4.5, 4.5.
Which is?
9 and 9.
Okay, so we've got 18 and 18 plus 18, okay, that's these two right here, plus another 18. That's 36 plus 36, which is now 72, okay?
The head's 18 as a
Plus
whole.
1 is 73, we'll leave that out for the last, okay? And so we need how much more?
18.
How much more to make a 100%?
1.
18.
18, okay?
Mhm.
18.
He said to leave the genitals for last. So
18 would
72.
be 2, and 8 would be 0. So we're at 90. Okay, we've got roughly
So-
8% left. Where do we miss?
Is the face separate from the rest of the head?
No, they're together.
What about the hands and or feet?
Now
I think
think
the
about the
thighs and
head.
arms
Are you
more.
thinking pediatric for 18?
No, I'm thinking an adult.
Okay, is the head how much?
I thought it was 18.
No, head is,
I'm getting
what do you got? Using your hand.
9-ish.
9-ish. Okay, don't forget, you can also take your hand and be like 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, that's a rough estimate for small burned
Okay.
areas. We got 9% here, all
Mhm.
together. So this is 9, so this is 4.5 in the front, 4.5 in the back. Okay, plus 1, so 9 is 99.
Are your thighs 18 apiece? No.
This is 4.5, 4.5.
Thighs are 18
But are your
apiece.
thighs 9 in front and 9 in back?
This is 18. No, thighs are 9 is 4.5 in the front, 4.5 in the back. Okay, because it's 9 altogether.
Okay.
9, think of it as 2 arms, 2 arm lengths,
Uh-huh.
okay? my arm by itself all around is 9%.
Right.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Okay.
Okay? So if you, when in doubt, take your hand and go 1, 2, 3, 4, 5, 6, 7, 8, 9.
So your whole leg is 18. Like one whole leg would be 18.
Yes.
Okay.
Okay? So,
Math
going
is-
back to our question, now
Math
we
is
drew
not
out
my
our
strong
man.
subject.
Okay? You have an entire head that is burned. Okay? Entire head.
So 9.
We got 9. Okay? And then both anterior upper extremities.
So 9.
What is the definition of an upper extremity?
Everything but
Your-
the waist.
Arms.
Okay? And what did it say? Anterior, right?
Uh-huh.
Okay? So that is cutting the arm in a 3D image in half. So 9 altogether, cut it in half,
4.5 on each
plus
arm.
times 2,
9.
9. Okay? So we have 9 plus 9. Now let's read the last part of the question. An anterior chest.
Plus 18. So 36. C.
Is this 18?
No, it's 9 for the chest.
9 for the chest.
So 27.
What about the back?
He just
You
said
said
anterior.
I know. Did we figure out the back earlier?
Yeah.
What was the back?
18.
I don't remember adding that 18.
You
Right
wrote an
there.
arrow by the head.
Oh. Okay. Got it. Okay. So you have front, that's 18. Okay. And they said anterior chest. So that is what?
27.
9. So we come out with what? 27.
27.
And 27 divided by 100 is what?
27%.
27% or
0.27.
there you go, folks.
Whoa.
So you'll get a scratch piece of paper, draw out your little man, Okay. a little Michelin man. That's what I did on my test. It works perfect every time. You can remember your numbers, and that's why you add them up to see how you're doing, because you're like, oh, that doesn't make sense. Okay, you gotta get to 100.
Yeah.
Okay.
It's been like 6 months.
Non-responsive man has shallow gurgling respirations at a rate of 8 breaths per minute. Initial treatment should include.
A.
Nicole?
Well, first you need a suction because he's gurgling.
Okay.
So it'd be A.
Elderly woman who was removed from a burning house by firefighters has full thickness burns to approximately 50% of her body. Appropriate treatment for this patient would include.
C.
Agreed? Upon arriving at the scene of a crash involving a large truck, you immediately note the presence of an orange placard on the side of the tank and the truck is polling. Okay? On the truck that is polling.
Oh.
This indicates that the vehicle is carrying a orange placard.
Explosive.
Flammable.
Flammable? Right.
What was
Yeah,
flammable?
Red.
Fire is what?
Red.
Red.
Red. Corrosive is what?
Yellow.
Yellow? No.
Green.
Corrosive is usually white. Okay.
Green is
What's
like
green?
it's
Green
reactive
is
to
non-flammable gases,
So I'm assuming it's
and
B.
yellow is usually radioactive. Okay. Orange is
Explosive.
explosive. Okay. Let's see here.
I have to go back to work.
You have to go back to work?
I do. But thank you, Nichols.
You are welcome.
I will text you. Manana.
Okay. Your test is tomorrow?
Yeah,
Good luck.
10:45.
Good luck.
Thanks.
I think we'll finish out probably at question 30 here.
Hey guys.
Everybody's fading fast.
Well, I have skin cancer.
Okay.
Good for you.
Micah just told me that's what it is.
Okay. After initial attempt to ventilate an unresponsive apneic patient fails, you reposition the patient's head and reattempt to ventilate without success. You should next.
See.
Presence of subcutaneous emphysema following blunt trauma to the anterior neck should make you most suspicious for. Okay. Presence of subcutaneous emphysema following blunt trauma to the anterior neck should make you most suspicious for.
Oh. That word esophagus, right?
Huh?
That it's ruptured.
Esophagus.
Yeah,
Okay,
it's
then
not
C.
esophagus.
Oh, dang.
I said it's not esophagus, but you clicked it anyways.
Fractured larynx. Okay. Larynx is right here. Subcutaneous emphysema is right here. Okay. Crushing or blunt trauma to the anterior neck can injure the trachea or larynx. Once the cartilages of the upper airway and larynx are fractured, they do not spring back to their normal position. Such a fracture can lead to loss of voice, airway obstruction, and leakage of air into the soft tissues of the neck. Air leakage into the soft tissues is called subcutaneous emphysema. Subcutaneous emphysema may also be observed in patients with tension pneumothorax, although it is typically located in the chest. Esophageal rupture would likely present with difficulty swallowing, dysphagia, and vomiting blood. You should suspect injury to the carotid artery or jugular vein if you observe a rapidly expanding hematoma to the neck following blunt trauma.
So I would have been right if it would have been a different location. It would have been down here.
Yes. Which of the following is abnormal finding? What is it, Nicole?
A.
Why?
Because the infant's heart rate's a lot higher than 80.
Okay. If it's under 100 for an infant, you need to start ventilating them, and if it gets under 60, you have to start compressions. Okay, for a heart rate. If they start having problems, I mean, if you can see obvious problems.
Then you need to compress at a rate of 100 beats per minute.
100 to 120. 50-year-old woman presents with acute shortness of breath. Her skin is pale and she is anxious. Okay, I'm going to end test, and we are going to just real quick, I want to do a simple 10-question test on OB and see how you guys are doing on OB and Peds.
Sweet.
Okay, OB and Peds, let's do 10, add. Which of the following signs and symptoms are more common in children than adults following an isolated head injury? You have just delivered a baby girl. Your assessment of the newborn reveals that she has a patent airway, is breathing adequately, and a heart rate of 130. Her face and trunk are pink, but her hands and feet are cyanotic. You clamp to cut the umbilical cord. The placenta has not yet delivered. You should. Vomit your patient. Remember what vomit stands for?
Yeah.
What does vomit stand for?
Vitals.
I would say
Vitals.
Vitals, oxygen,
Oxygen.
monitor, IV impression, transport. Which one of these takes care of all that?
C.
Keep the newborn warm. Give oxygen to the mother if needed and transport. You can't forget about the mother.
But what about? Never mind.
Okay, don't overthink the question. Are you taking care of the newborn? Are you taking care of the mother? And are you transporting?
Mhm.
What about?
Like, if its hands are blue and stuff, is that normal? I guess when you deliver.
It's okay for them to have
Because they're
their
not
hands-
like fully circulated yet,
Right.
or what?
That's why you gotta keep them warm, you gotta get them circulating, and that whole part is gonna be warm, dry, suction, stimulate, okay? That's that whole process right
Warm,
there, but it's
pink,
just
and sweet.
asking for the very first thing, yes, keep them warm, pink, and sweet, okay? It's okay. Cyanosis of the periphery of the body, which is called acrocyanosis, is a normal finding in a newborn. You should not wait at the scene for the placenta to deliver. It can take up to 45 minutes. A woman is having her first child, first stage of labor.
Well, C is true.
Okay?
First stage of labor is normally the longest, isn't it?
Okay?
I'm thinking D.
It's not A. It's
Read,
not
read the
B.
question again and insert your answer to it,
A
Nicole.
woman.
If a woman is having her first child, the first stage of labor is shorter in women who have had other children. So no, because it's her first child? I'm just saying C is true. I didn't say if it was the right one.
Okay, that's great, but that's not the correct answer.
I didn't say it. I didn't say I was trying to pick it. I was still trying to rule out other answers. I'd say either D, probably
Like
D.
16 hours is ridiculous.
But
I don't think it's gonna be
it only lasts, but 2 hours is long too.
It's not for labor.
Which one? Pick one. Go with your gut.
B or D.
Go with your gut. Nicole, go with your gut. Pick an answer.
B.
Oh.
Shut up! You were trying to disagree
Okay.
with D.
It takes a long time. First pregnancy, long time for them to deliver, okay? Some people go a little bit faster, but it takes a long time. After an advanced airway device has been inserted in a 6-month-old infant in cardiopulmonary arrest, you should deliver ventilations at a rate of,
A 6-month normal?
Yes.
Breath a minute.
are you sure?
They're small, they need more press than a bigger person, they breathe faster. That's what I'm thinking. Oh, I didn't see, I thought that was 10. Come here, you can't see a 3 from here.
Oh.
Excuses.
No, really.
What would
I-
12,
I
what would
can't
12 breaths a minute be?
See,
It would be, Brady
A breath every,
every 5 to 6 seconds.
12 breaths a minute?
No. I'm trying to do math in my head, so.
It'd be a breath every 5,
5,
seconds. Okay. How about 10 breaths? That would be a breath every 6. 6 times 10 is
60.
60. 3-year-old child experienced a seizure that lasted about 10 minutes. He has a fever of 103.5. The skin is hot to the touch. He has a rash on his trunk. The EMT should suspect.
Can I answer?
Nicole?
D.
B.
Okay. They're having febrile seizures.
Okay, well, that's what. Okay, can you listen to my thought process?
I'll listen to your thought process.
I just didn't know about the meningitis because I know that's the signs and symptoms of a febrile seizure. Because they always get that rash on their trunk whenever they have febrile seizures. But every child I've had that's had a febrile seizure has had a rash on their trunk, and then had fever, obviously. But that wasn't up there as an option. So then I didn't think about the other ones.
Thing about meningitis, it is messing with the brain, and the temperature regulation is in the brain. Okay? Meningitis deals with the meninges, which are the little coverings inside the brain. It's inflammation of that. Okay? The rash is not an allergic reaction rash. It's a heat rash. Okay? Because their temperature is at 103.5. Okay? Called to a local park for a 7-year-old boy with respiratory distress. During your assessment, you find that the patient is wheezing, has widespread hives, and facial edema. You should suspect blank has occurred.
Allergic reaction.
You agree?
Yeah.
5-minute Apgar assessment of a newborn reveals a heart rate of 130, cyanosis of the hands and feet, and rapid respirations. The infant cries when you flick the soles of his feet and resists attempts to straighten his legs. These findings equate the Apgar score of.
So is that when you're pulling on the legs?
I pull on your leg, you're going to retract your leg back.
Yeah.
That's a good response.
Okay.
Everything's right.
Everything is
Except for rapid
right.
respirations.
Everything is not all right.
But not
Heart
the
rate's
respirations, but what I'm saying is like it's responding. But you just said that the cyanosis of the hands and feet is normal when you deliver a baby,
Right.
right?
But the rapid respiration.
But an Apgar score is just what we grade them at, because you have to do an Apgar score when they're first delivered, at 5 minutes, at 10 minutes, at 15 minutes. Yes. Welcome to labor and delivery.
I try to avoid OB.
You should go over there. You might learn something.
No, they offered me a full-time position. I said no. I don't need no babies.
Okay.
I'm thinking B.
If they have cyanosis of the hands and feet, okay, you have A, P, G, A, R. What do they stand for?
Airway.
Appearance,
Oh, here.
pulse, grimace,
Airway.
no, activity, and I think it's respirations. Okay. What are the scores? You remember?
No.
0, 1, 2. Okay? There's 5 of them, times 2 gets a max of what?
10.
Okay. So is this kid a 10?
No.
No.
Is this kid a 0
No.
on all of them? Is the kid dead?
No.
Okay?
Kid's
5
not
stay
good.
alive is basically barely the kid can maintain. He's got a 1 in all these categories, or he's got a 2 and then, some other ones, okay? He's got to have a 0 in one of the other ones. Okay, he's got a heart rate of 130 beats per minute,
That's good.
okay?
Good pulse.
His appearance, He has cyanosis of the hands and feet. Is that pink extremities and pink everything?
No.
I'd say that's a 1.
There you go.
And the respiratory, I'd say it's a 1.
Infant cries when you flick his soles of his feet and resists attempts to straighten his legs.
2.
So activity.
2.
Okay, is he actively flailing around though?
It doesn't say.
No, but he resists your attempt when you try to pull on him. If he's actively moving, that's a 2. Think about everything he can do on his own. Is he doing that on his own?
Okay.
Okay? He has rapid respirations. Rapid respirations.
So it's not good, but it's not
1.
a 0.
Okay? And you flick the soles of his feet. He's crying.
So that's 2, right?
He's crying. Okay? Based on what I would say he's probably a 2 there. Because you flick the soles of his feet, you have an appropriate response.
So he's at 7.
Right. But the other thing that I'm trying to remember back is if he's crying spontaneously or if it's a crying upon command. It's kind of like GCS scale. Spontaneous versus non-spontaneous. So it's a possible 1. This one is a 1 or a 2.
Well, it can't be because we can only have a 7.
I know. So it's 1, 2 is 3,
We're at a
4,
7,
5.
2.
6, or 7. Okay, so we're gonna have to go with a 7. You guys cool with that?
Yep.
Okay, here's why. Score of 1 is assigned for the appearance in the newborn's body is pink. We got that. Okay, the heart rate is greater than 100 beats per minute. Received a score of 2 for the pulse. We got that. Okay, if he cries and tries to move his foot away when the soles or feet are flicked, it's assigned a score of 2.
Okay.
Okay, so we were good there with the 2 there. So far we're up to 5.
I think the activity's going to be 2 also.
I'm guessing it's probably going to be a 2. Okay, activity. If he resists attempts to straighten his hips or knees, a score of 2 is assigned for activity and muscle tone. Okay? And respirations are rapid, a score of 2 is assigned based on these parameters. Okay, so we have a 2 here and a 2 here. So besides the appearance, he's doing fine. Okay? So you could also answer this question in another way. Nicole said everything seems to be fine with the kid except for the cyanosis. Okay? So we know that fine in Apgar is 10, and pretty much, as the OB nurses would tell you, no baby is ever a 10 on 5 minutes. No baby is ever a 10. Okay? So if nobody's ever a 10, we don't have 0 here, so go with 9. Okay?
Can you give a 0?
If the baby's dead, yes.
Well, I know on
Mortal
the stroke
son of a
scale
gun.
you can't give a 0.
You morbid man. Alright,
On
of the
stroke
following,
scale,
the
I
most
believe-
detrimental effects of gastric distension in infants and children is what?
See.
Because they can't take a deep breath because their belly's so full it's pushing up, right? Where they're at there.
Gastric distension can be lethal if not detected and managed appropriately in any patient, but especially infants and children. As air insufflates the stomach, the diaphragm is pushed into the thoracic cavity, which decreases the amount of air that can fill the lungs.
So it's bloating.
So if you're going less than what you need to, it's not going to be enough to go into the lungs, it's going to go into the stomach, and the cavity, the thoracic cavity, is not going to push it back out of the stomach. Okay. Upon delivery of the baby's head, you note that the umbilical cord is wrapped around its neck. You should.
D.
Why?
Because you're supposed supposed to try to take it out from around the infant's neck where it can choke the infant to death.
If not, clamp and cut the cord and continue with the delivery. If one attempt, then cut that cord and get that baby out of there. Otherwise, that baby's gonna die.
I read that.
Is there
or
any
I had that question the other
hazard
day.
of cutting the cord?
Huh?
Is there any hazard of cutting the cord without?
You're
trying to
cutting off
cut
their
it?
supply.
So you gotta get them out of
You gotta get them out of there. Once you cut that cord, you're committed.
That's like life support for a baby.
It's like pulling an electrical cord. Okay. You're treating a 5-year-old child who has severe diarrhea and vomiting for 3 days and is now showing signs of shock. Supplemental oxygen has been given and you have elevated the lower extremities. En route to the hospital, you note that his work of breathing has increased. You should. Read your answers, read the question, read your answers again. See if you did something to the patient that might have changed something. Remember, less invasive before most invasive.
Listen to lung sounds.
Is lung sounds going to change something?
Oh, true.
You need to do treatment for this patient.
Lower the extremity.
Lower the extremities and reassess the child.
I guess you'd listen to lung sounds while reassessing.
You would reassess the child by listening to lung sounds, but remember to treat the patient.
Yeah.
Lower the extremities is a treatment. Okay. All right.
99%.
All right. I'm gonna shut off the video here.